Hi, I'm Kristin Oliver, Dr. Oliver, and it's wonderful to meet you. I put together this short video to answer some questions you might have before you make the trip in to see us from out of town. So I want to kind of let you know what's going to happen on the day of the procedure so you're aware and feel more comfortable. So when you first get to the office, the medical assistants or nurses will bring you back to your room. They'll make you comfortable, and they start by pulling some peripheral blood from your arm. And that peripheral blood goes in an FDA-approved device in order to concentrate your peripheral blood into what we call platelet-rich-plasma, or PRP. And some of you, if we're just doing a platelet-rich plasma graft, that's the only invasive part to begin with, the beginning harvesting part of the procedure. If we're going to do a bone marrow aspirate graft along with it for stem cells, then after the blood is drawn, the nurses will call me into the room. I then take a few minutes using an ultrasound to find the best area on your posterior pelvis, which is kind of halfway between your low back and your hip. And I take a little bit of bone marrow from that area. But before I do anything, I use an ultrasound to make sure we mark the correct area. If you get the right spot on that bone, on that iliac crest, taking out the bone marrow is much more comfortable. I then use some local anesthetic to numb up the area really well, the skin and the bone, so that when I place the bone marrow aspiration needle into place, you really don't have much discomfort at all. But when I start aspirating the bone marrow, you're going to notice what is sort of like a Charlie horse cramp in your buttock. And it'll last anywhere from a minute to a minute and a half. But as soon as I'm done drawing out that bone marrow, that pain goes away. Then when we're done with that, the bone marrow is placed into that same FDA-cleared device. It's reprogrammed in order to extract stem cells and other cells we want from your bone marrow. And that'll take about an extra 20-25 minutes. So really there's a big amount of downtime from when we aspirate and harvest until I'm ready to go ahead and inject. During that period of time, I'm going to take as much time as we need to be able to get to know what we're treating better, your joint, your soft tissue, whatever we're treating. I'll do a bedside ultrasound. I'll be able to share with you exactly how many injection sites you're going to need, and I'll be able to let you know about how long it's going to take. But on average, the procedure from start to finish is about 2 hours, from the time you come in till the time you leave. Then when we're ready to inject, we obviously sterilely prep and drape the area we're going to inject to ensure a low risk of infection. I gown and glove for the same reason. And we then begin the injection process. Now don't worry, we'll make sure you're numbed up when we go. Everything will be numb and comfortable. A lot of people have anxiety about the whole bone marrow aspiration, about the injections. Totally understand. So we can provide you with some pre-treatment anxiety medications such as Valium in order to make you a little more relaxed. Most people don't need the Valium, but it definitely helps. So if you by any chance think you might need it, just make sure you let our staff know before the procedure, and we'll get you a prescription and you can bring that in with you. And just to also let you know one thing that's going to happen, you'll be really numb for the first hour or two. You'll feel good, that's the numbing agent. So you'll feel good when you leave, but that numbing will wear off usually after an hour, hour and a half, and you may have more pain. So we'll provide you with a prescription for some pain medication for you to start taking when you leave. Now after the first 2 to 3 days, you'll go back to what we call baseline. So you'll feel really no better, no worse. Then you start feeling a little bit better, normally starting in about 2 weeks and sometimes 4 weeks in some cases, but you get progressive and vast improvement between that 2 weeks and about 8 weeks. And then we give you a call at 8 weeks to see how you're doing. And depending on that 8-week phone call, we have to decide where we need you. Possibly need another booster shot of some PRP, some more platelet-rich plasma. Do you need some physical therapy, or where do we need to go from that point? Unfortunately, since you live at a distance, a face-to-face office visit is difficult. So we'll do all of this over the phone. And we've been doing this out-of-town treatments for over 15 years. So I promise you, we'll be able to get you taken care of regardless. The most important thing is that you continue to communicate with us. If you have any questions, problems, or issues, you give the office a call. Again, the number to call will be 573-446-4000. And we look forward to seeing you here in Columbia, and we look forward to helping you with your pain. Thanks so much.